Hi everybody, welcome back to another video. Today I would like to talk about something that I get asked about on a fairly regular basis, specializing. So if you're new to the channel, my name is Nguyen, and I'm an oral medicine specialist in Perth, Western Australia and Darwin, Northern Territory. So these are some of the questions that I get asked the most frequently. Just a disclaimer that these are my thoughts and opinions only, and that I'm trying out a new style of video where there is very little editing and I basically talk at the camera. So let me know if you like this style of video or not. So the first question that I get asked about is my pathway to specialization. So I completed my general dentistry degree, a Bachelor of Dental Science from the University of Melbourne about 9 years ago. Following that, I worked as a general dentist in the Royal Australian Navy in public and private practice. During that time, I also completed my membership in the Royal Australasian College of Dental Surgeons in the general dental practice stream. So that's your MRACDS GDP. And then I applied for specialty training and I got accepted. And then I completed a 3-year full-time Doctor of Clinical Dentistry in Oral Medicine. The point that I would like to make here is that if you are thinking about specializing, the Australian Health Practitioners Regulation Agency, so AHPRA, requires you to have at least 2 years full-time general dental practice experience or the equivalent before you can be registered as a dental specialist. The other question that I get asked is if I always knew I wanted to become a specialist. Definitely not. So if you knew me when I was a dental student in Melbourne, you would know that I wasn't particularly studious. I had just come from year 12 after many years of studying, and doing more study was the last thing that I felt like doing. It did take me a few years, even up to, several years after graduation, for me to decide that further study and oral medicine and pursuing the path of becoming a specialist was something that I wanted to do. So if you are wanting to take more time before coming to this decision whether you want to do it or not, I think that is absolutely fine. I don't think there's anything wrong with that. So the next question I get asked is if I should specialize. So the person asking me, I was like, oh, Amanda, should I specialize? Now, that is a very individual question and only you will know the answer. But I think the most important thing about that is to actually be honest with yourself and ask, why do you want to specialize? So people often introduce themselves to me as just a general dentist. Well, and I always correct them because the thing is that they are not just the general dentist. Being a good general dentist is very difficult and requires a lot of skill. And often, in most times, the general dentist is the person that's in charge of the person's overall dental health. They're the gateway they're the gateway to specialists. They decide whether the patient needs to be referred or not. So specifically in oral medicine, if the general dentist isn't picking up lesions that could be malignant or potentially malignant, they don't really get referred into oral medicine. So general dentistry is a very difficult job and it's not easy to do it well. So I often feel like people sometimes think that it's prestigious to be a dental specialist. I don't really believe in that. I think confidence and the perception that whether your job is valuable or not comes from within, and being a specialist doesn't make you better than anyone else, nor is it a better job. Now, the other reason to consider is that, are you thinking about specializing because you're burnt out? Are you sick of clinical dentistry? And do you think that becoming a specialist is different but still similar to something in the field? Now, this is something that I would probably caution against, because I think that if you are burnt out as a general dentist or doing clinical dentistry, becoming a specialist isn't going to fix that. In fact, it will probably make it worse. It will make completing your specialty training a real struggle if you aren't in the best frame of mind, just because it's so demanding. And the other thing as well is that if you do manage to finish the specialty training program, do you love it enough to do it for the rest of your life, and only that for the rest of your working life? And then there's all the additional stresses of dealing with, challenging cases, challenging patients, because you don't get referred easy cases. Financial stresses, work-life balance. So I think if you're considering specialization as a escape from general dentistry, that I would be very careful about that. Now, the other thing is, are you specializing because of money? Now, specialty training is a real sacrifice. So you sacrifice time, sleep, lifestyle, and it is a big financial sacrifice as well, which I think a lot of people don't necessarily realize. So you stop working essentially for 3 years while you are doing full-time study. You pay university fees, which are very high. And in most cases, and I don't think I'm wrong in saying this, in most cases, you earn a smaller income than a general dentist for at least the first few years out, maybe even longer. And plus, then you've got your loans, which can make things even worse. So, if anything, you will probably be behind your peers in terms of finances and in terms of your life timeline as well. Like, for example, having children. So, specialty training should never be pursued because you think that is going to make you money when you finish, because that's plainly and simply not the truth in most cases. And the last one is that, are you specializing because you think that you want more knowledge? Well, just keeping in mind that a general dentist can actually do any procedure. Like, there's no restrictions in anything that a general dentist can or can't do if they're adequately trained. Is what you are learning or wanting to learn or wanting to improve on something that has to be done through a specialization program. In most cases, I would say probably yes, but not in every case. And, so that is something that I think has to be weighed up against the balance of everything else. So you've thought about it and then you've decided that you want to specialize. So here are my top tips for applying for specialty training. So I feel like a lot of people that I talk to are more concerned with actually getting into the program than what happens when they graduate from the program. Now, the important thing to think about is what job opportunities there are when you finish. So in some places, in some specialties, the job market is absolutely saturated. It will be very difficult to find a job as a specific specialist in a specific place. This is increasingly becoming the reality as well. So what I would recommend is that if you know what the job situation is like when you graduate, you can decide if you're flexible to move or not. Because most cases, if you want to be busy when you become a specialist, that may require you moving away from the capital cities. Of course, every specialty is different, but just as a general scope, like, it's a good idea to know what's going to happen once you finish the 3 years training. The other thing as well, my second tip is to speak to the current registrars or residents in the program or recently graduated specialists for insights into the course. Because the thing is that specialty training courses all have their strengths and weaknesses, and they differ from university to university. So only by speaking through to people who are in the program or recently finished the program or are involved with the program will you understand those nuances between the different training programs. This sort of brings us back to the first point about knowing what the job market is. The other thing which I think is quite basic that people really should know is the job of the specialist actually what you think it is? So besides clinical work, there's also research, teaching, public speaking, networking, marketing, hours of paperwork. The only way to know what the job actually entails, in my opinion, is to spend some time with a specialist. So in my case, for 1 day a week, every week for 6 months, I went into the oral medicine clinic in Perth, and I followed the oral medicine specialist around so I could really understand what the job was and if this was something that I wanted to do. So I would really recommend that you do that. As long as possible would be good. I don't think a few weeks is sufficient to really understand the whole scope of the job, but obviously that has to be practical as well. Now, my other point is that when you apply for the course, make sure that the people who are on the selection committee, or one of the people on the selection committee, actually know your name. So your name should not be unfamiliar to whoever's making the decision. So what I mean by that is that either you would already have introduced yourself to the course convener and asked him or her questions about the course, done some research, have published a paper, so your name's out there, or you have, met them at CPD courses in common. So one of the things that I think that the course conveners really want to know is that you actually are interested in the specialty. So doing all of this just gives them a really good indication of that you've done your research and you know what the specialty is about and that you are keen on it. Now, the other point is to consider your finances. As we've already talked about, it is a financial sacrifice to do specialty training. You may not be able to work part-time or on weekends depending on your specialty and your university. So if you can't work part-time, or if you can't work on weekends to supplement your income, financially will you be able to finish the course or not? Because there's probably nothing worse than doing the course halfway and having all of these financial stresses that will make it a lot more difficult. My final tip is family planning. So I get asked, can I have kids when I'm doing the program? You definitely can, and I do know people that have had kids during their course. I don't know if anybody actually chose to have kids during the course, because it isn't easy. It does add a layer of complexity on top of your training program. Alright, so I think we're at the end of the video. That's just over 10 minutes now. So on a lighter note, I would like to say that you will meet some amazing people. I've made so many friends through my postgraduate training, and I've discovered the things that I really like to do. I have absolutely no regrets in specializing. And if you've got any questions, feel free to drop me a message below. Alright, thank you. Bye.